Right now, our kids are getting hit with a number of illnesses. You may have read headlines that the nation is experiencing a trifecta of respiratory illnesses between COVID, RSV, the flu. And now Colorado has a fourth illness impacting our kids. The state health department says 2 children infected with invasive group A strep have died since November 1st. In total, 11 kids have been hospitalized from group A strep in that same time frame. And for comparison, the state says we typically see maybe 1 or 2 cases a month. And many of these cases also experience recent illnesses such as COVID, flu, or RSV. Denver 7's Patrick Perez spoke with health experts about what parents need to know heading into the holidays.
I know you parents out there are probably exhausted hearing about yet another illness going around. Perhaps your own kids have gotten COVID, flu, or RSV in the past few months. The good news with this group A strep infection, the state health department says it is rare. I spoke with the state epidemiologist about what it is and how it affects kids, and here's what I learned. Invasive group A strep is not like strep throat that we're used to talking about or getting swabbed for. This infection is caused by the bacteria getting into the bloodstream and other parts of the body. Why that's concerning is that it can cause flesh-eating disease or toxic shock syndrome. Dr. Rachel Hurley with CDPHE says kids can get this type of infection after first getting infected with something else.
One of the scenarios that we've been seeing are children who have these preceding viral respiratory infections, COVID, RSV, flu, and then they start getting better and then they get sick again or develop new symptoms. And that's really when we start worrying about these invasive bacterial infections.
So what should you be looking out for in your kids? Well, the symptoms include redness of the skin, ulcers, severe pain, fever and chills, low blood pressure, rapid breathing. So certainly get help if your child is experiencing any of these symptoms. As for how to prevent it, CDPHE recommends making sure your child is up to date with their COVID, flu, and chickenpox vaccines. Getting these infections can increase the risk for getting invasive group A strep. And while CDPHE and the CDC are keeping an eye on this, RSV is not in the rear view yet, but the state says it is seeing improvements in RSV numbers like hospitalizations and positivity rates. In the newsroom, I'm Patrick Perez, Denver 7.